This is called anterior pelvic tilt. You will notice a rounded lower abdomen and a strong arch in the lower back. The opposite is called posterior pelvic tilt. So remember, this is anterior tilt and this is posterior tilt. Anterior tilt is very common, seen in over 75% of all adults. In fact, you may have noticed a lot of athletes have this posture, especially sprinters. But there are two reasons to try and reduce excessive anterior tilt. Firstly, it could be contributing to your lower back pain, especially if going into posterior tilt position relieves that pain. And the second reason is aesthetics. There's no harm in trying to reduce your anterior tilt. And the exercises you see next are good for you as well. Number 1. Stop wearing heels or reduce the size of your heels. We already know that wearing heels encourages anterior tilt. Number 2. Strengthen the muscles that pull us out of the anterior tilt position, namely the abdominals and glutes. There are many ways to do this, so I'll demonstrate just 2. Keep the back flat on the floor. If there's a space here, it means you are now moving back into the anterior tilt position. Notice I'm now in the posterior tilt position, which is what we want. If it's too hard, try these variations instead. Bridging exercise. Try and keep your back flat so you're in a posterior tilt position. You can also add some weight and try different variations. And number 3, this movement also strengthens your core, which is good for your spine. Relax as you breathe in, and as you breathe out, draw in your abdomen and posteriorly tilt your pelvis. And repeat again, breathe in and breathe out. If you're having trouble flattening your back against the wall, just bend your knees. Now integrate this into your everyday life as you stand, walk, and even run. Number 4. Having tight quadriceps might encourage anterior tilt. In my opinion, this is the best way to stretch it, because you can combine it with posterior pelvic tilt and drawing in maneuver. And lastly, it's good to know that you can reduce your anterior pelvic tilt. It's been shown before.